Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Head lice. Introduction. Head lice are tiny wingless insects that live on people's heads and feed on their blood. Head lice are very contagious. They easily spread through close contact or sharing personal belongings, such as hats, pillows, or hairbrushes. This program will help you understand head lice. It discusses the symptoms, causes, diagnosis, and treatment of head lice. What are head lice? Head lice are insects without wings. They live on people's heads and feed on their blood. They are a type of parasite. An adult is called a louse and is 2 to 3 millimeters long, or about the size of a sesame seed. Head lice eggs, which are called nits, are even smaller. The eggs look like dandruff flakes. Lice and nits are easiest to detect at the neckline and behind the ears. A female louse produces about 100 eggs. The eggs hatch in 5 to 10 days. They mature in 10 days and live about 3 weeks or more. Head lice are contagious. Close person-to-person contact or sharing personal belongings such as hats puts people at risk of catching head lice. Head lice cannot fly or jump. Dogs, cats, and other pets don't spread human lice. Head lice are not known to transmit diseases and are not considered dangerous. Children ages 3 to 11 and their families get head lice most often. Symptoms. Symptoms of head lice include a tickling feeling of something moving in the hair, itchy scalp. Some people with head lice may experience irritability and difficulty sleeping. Head lice can be associated with sores on the head, but it is the scratching of the scalp that causes the sores and not the head lice. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. The most common way to get head lice is by head-to-head contact with a person who already has head lice. Close contact can be common among children during play at school, home, or other public places. Lice can live for about 2 days without a meal. If lice stay on a pillow or other fabrics, it is possible for other people sharing the fabric to get lice. Transmission of head lice may happen while wearing clothing worn by a person with lice, using combs, brushes, or towels that have lice on them, lying on a bed, couch, pillow, carpet, or stuffed animal that has recently been in contact with a person with lice. Children are more likely to get head lice because they are in frequent head-to-head contact as they play. Women are also more likely to get head lice than men because they have longer and thicker hair that can touch the hair of a person with lice. Diagnosis. Your healthcare provider can diagnose a head lice infestation by finding live lice on your scalp or hair. Lice are hard to find because they are very small, move quickly, and avoid light. Using a fine-toothed louse comb may help when looking for live lice. Head lice and eggs can be visible with the naked eye, but use of a magnifying lens or a special light to turn the eggs blue may be necessary. Lice eggs are often confused with other particles found in hair, such as dandruff, hairspray droplets, and dirt particles. If lice eggs are found firmly attached to the roots of hair shafts, it suggests but does not confirm a lice infestation. Lice eggs that are attached more than 1/4 inch, 6 millimeters from the roots of the hair shaft are almost always hatched or dead. If no lice are seen and the only eggs found are more than 1/4 inch or 6 millimeters from the scalp, then the infestation is probably old and no longer active. If this is true, treatment is not required. Treatment. Treatment for head lice is recommended for people diagnosed with an active infestation. All household members and their close contacts should be checked. Anyone showing evidence of an active infestation should be treated. Treating a head lice infestation usually requires special medicated shampoos or hair creams. Many of these can be bought without a prescription. Pay special attention to instructions on the label or in the box. These instructions will tell you how long the medication should be left on the hair and how it should be washed out. Different treatments for head lice may come with different instructions. It is important to follow the instructions that are included in the package or on the package label. If the non-prescription medication does not kill the head lice, your healthcare provider can prescribe a stronger shampoo. Preventing head lice. The following steps can be taken to help prevent and control the spread of head lice. 1. Avoid head-to-head or hair-to-hair contact during play and other activities at home, school, and elsewhere. 2. Do not share clothing such as hats, scarves, coats, sports uniforms, hair ribbons, or barrettes. 3. Do not share combs, brushes, or towels. Soak combs and brushes used by a person with head lice in hot water at least 140 degrees Fahrenheit, 60 degrees Celsius, for 5 to 10 minutes. 4. Do not lie on beds, couches, pillows, carpets, or stuffed animals that have recently been in contact with a person with lice. 5. Machine wash and dry clothing, bed linens, and other items that a person with lice wore or used. Use the hot water laundry cycle and the high heat drying cycle. 6. Vacuum the floor and furniture, particularly where the person with lice sat or was lying. Do not use fumigant sprays or fogs to treat a lice infestation. These products are not needed and can be toxic to people and pets. It is difficult to prevent the spread of head lice among children because there is frequent head-to-head contact as they play. If your child gets head lice, it does not mean you have bad hygiene habits. Just get rid of the head lice by using special shampoo. Teach your child not to share hats, combs, scarves, and other hair decorations with their friends. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Head lice are insects that live on people's heads and feed on their blood. Head lice are contagious and spread through close contact or sharing certain personal belongings. Head lice are not known to transmit any disease and are not dangerous. Your healthcare provider can diagnose a head lice infestation by finding live lice on your scalp or hair. Head lice can be treated with special shampoos or head creams. All household members and other close contacts should be checked. Anyone with signs of an active case of head lice should be treated. If your child gets head lice, it does not mean you have bad hygiene habits. Just get rid of the head lice by using special shampoo. Teach your child not to share hats, combs, scarves, and other hair decorations with their friends. Thank you for using Explain.